Ben's mother was recently diagnosed with osteoporosis after fracturing her hip. Worried about his own risk of developing the condition as he gets older, Ben, in his early 40s, started researching preventive measures. Favoring natural remedies over conventional medications, Ben decided to consult Dr. Ella, a medical doctor known for her holistic healing approach. Ben's mother joined him for the appointment, arriving in a wheelchair. She was eager to learn more about her condition, as her previous doctor had only prescribed medication and offered little information. When they entered Dr. Ella's office, she warmly welcomed them, standing up from her chair to greet them. "Welcome. Please come on in. It's good to see you both."
Thank you, Dr. Ella. It's nice to be here. This is my mom. She insisted on coming with me today.
Nice to meet you, Doctor. My name is Josie.
Pleasure meeting you, Mrs. Josie. I'm glad you came along. The more the merrier. Please make yourself comfortable. So, Mr. Ben, what brings you in today?
Well, my mom was diagnosed with osteoporosis after she had a hip fracture. I don't know much about it, but I've heard it can be related to aging and genes. I'm scared of it happening to me too in the future. So I'm here to learn more about the condition and how to prevent it.
I understand your concerns, Mr. Ben. Osteoporosis is indeed something to be aware of, especially if you have a parent with the condition. Mrs. Josie, I'm sorry to hear about your diagnosis. How are you feeling?
Aside from being afraid to sneeze in case my bones shatter, or have my grandkids call me Granny Fragile, I'm doing okay.
Mom, stop joking around.
Your bones aren't going to shatter, Mrs. Josie. Osteoporosis can be quite painful and uncomfortable, but it's manageable. It's a condition where bone density and strength decrease, leading to fragile bones that are more subjected to fractures. This happens when the body loses too much bone, makes too little bone, or both, making fractures more likely even from minor falls or daily activities.
Oh, Doctor, I got my fracture while waltzing to one of my favorite Mexican songs. You see, I used to be the queen of the dance floor, but now the only moves I'm doing are from my recliner to my wheelchair.
Mom, we are not here for that. Don't mind her, she's always trying to make a joke. Please tell me, Doc, this osteoporosis, does it mostly occur when one hits a certain age, or can it happen at any time? And which gender is more prone to experiencing it?
Good questions. Osteoporosis is particularly common in elderly people, and women are more likely to have it than men.
Really? Why is that so?
It's mainly due to hormonal changes, especially the decrease in estrogen levels during menopause. Estrogen helps sustain bone density by suppressing bone breakdown. When estrogen levels decline, bone loss accelerates, leading to a greater risk of osteoporosis in women. Additionally, women tend to have smaller, thinner bones than men, which can contribute to their increased vulnerability.
That's why I tell you to always treat a woman delicately like an egg. We go through a lot, my boy.
I know, Mom. You've been saying that since I was like 5. I get it now, Doctor. Can you please tell me about the ethnicity that is more subjected to osteoporosis, and what specific types of foods can be consumed to prevent it?
Well, osteoporosis affects people of different ethnicities and races in various ways. It all depends on factors like genetics, bone mass, and lifestyle differences. However, according to a comprehensive study, white women are most likely to develop osteoporosis, but Black women are far less likely to suffer from it. In fact, their risk was said to be a whopping 50% lower. Hispanic and Asian women also have a lower risk, with a 25% lower chance of developing the condition. And while women are more likely to develop osteoporosis than men, it's important to remember that anyone can suffer from brittle bones. To prevent this condition, it's essential to consume foods rich in calcium and vitamin D. These nutrients are necessary for maintaining bone health and preventing bone loss.
All right. Can you give us some examples of foods with these nutrients?
Sure. Leafy greens like kale, broccoli, and spinach are great for vitamin D. Fish like salmon and sardines, and dairy products like milk, cheese, and yogurt are equally high in calcium and vitamin D. Soy products, nuts, and seeds also provide essential protein and magnesium for healthy bones.
Those are mostly what I eat daily. My previous doctor also recommended them to me, and I've been noticing some minor positive changes lately.
That's wonderful to hear, Mrs. Josie. In addition to these foods, maintaining a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can further support overall bone health.
Thanks for the insight, doctor. Does this mean that if I start eating more nutrient-rich foods, I might not develop osteoporosis?
Well, eating a balanced diet alone isn't a guarantee against osteoporosis. There are other habits you should consider too.
Really? What kinds of habits?
The first habit is exercising. Incorporating weight-bearing exercises like walking or weightlifting strengthens bone density. It's also important to avoid smoking and excessive alcohol consumption, which can weaken bones. Taking precautions to prevent falls, like keeping your home clutter-free and wearing proper footwear, is super important too. By adopting these habits, you can reduce the risk of osteoporosis and maintain strong bones for life.
Duly noted. But do taking vitamins and minerals as supplements help to prevent osteoporosis? If so, which vitamins should we focus on?
Well, I have some reservations about taking supplements, as I always recommend getting these vitamins from your diet instead of supplements. Studies have shown that calcium supplements may not provide health benefits and can even be harmful. This means getting your calcium from food is the safest option, while too much calcium from supplements might pose health risks. These risks include constipation, severe diarrhea, and abdominal pain. Calcium carbonate, in particular, is often associated with gastrointestinal issues like constipation, gas, and bloating. For bone health, it's important to consider not just calcium, but also vitamin D, magnesium, and vitamin K, which can all be gotten from your diet.
Wow, that's eye-opening.
I'm really surprised to hear this. I've been taking different types of calcium supplements for years and experienced many of the side effects you mentioned, especially bloating and nausea. I thought it was part of the healing process. Now I know better.
I'm sorry to hear about your troubles, but that's the hard truth. If you focus on eating a healthy diet, especially foods rich in calcium, you won't need to rely on supplements and endure their unpleasant side effects. One calcium-rich food I often recommend to my clients is sea moss. Have you heard of it?
No, I haven't. Please tell me about it.
Sea moss, also known as Irish moss, is a type of red algae rich in nutrients like calcium, iodine, potassium, and vitamins A, C, E, and K. It's especially good for bone health because it contains high levels of calcium and proteins that help maintain strong, collagen-rich bones, making it beneficial for those with osteoporosis. Sea moss also has proline, an amino acid that turns proteins into energy and provides antioxidants. These antioxidants fight harmful free radicals, repair cells, and boost collagen production, which helps strengthen joints and prevent muscle soreness. Its iodine and B vitamins further help to support bone repair. For example, a 2018 study with 80 patients who had musculoskeletal issues found that sea moss supplements increased strength and energy while reducing pain. The participants who took higher protein sea moss supplements had better muscle recovery, thanks to their protein content. To include sea moss in your diet and help prevent or manage osteoporosis, you can add it to smoothies, soups, or salads. It can also be consumed as a gel, powder, or capsule, making it easy to incorporate into your daily routine for stronger bones and overall better health.
Got it. But if calcium supplements are bad, does that also apply to sea moss supplements?
Well, I only brought up sea moss supplements because sea moss comes in different forms, and the supplements were part of the study I mentioned. However, I will never advocate for my patients to take supplements. Eating healthy food still remains the best medicine.
That's very true. I totally agree. But is there a specific age when we should start focusing on these vitamins and minerals for bone health?
It's best to start prioritizing these nutrients in childhood and continue throughout life. Building strong bones during childhood and adolescence helps reduce the risk of osteoporosis later on. And I often tell my patients to prioritize giving their children foods rich in these vitamins over supplements, and minimize giving them candies, fries, and other processed foods that aren't good for their bone health and overall development.
Ben has always been good about drinking his milk and eating his veggies since he was little. I rarely give him processed foods. We mostly eat homemade meals prepared from foods we grow ourselves. I guess it's paying off.
Mom, come on.
It sounds like you've been doing a fantastic job, Mrs. Josie. And Mr. Ben, there's no specific age that's too early or too late. Maintaining bone health is super important throughout life, so it's always beneficial to prioritize these nutrients in your diet. As we age, it becomes even more important.
I understand, but I'm really curious. Please, what exactly happens when someone has osteoporosis?
Interesting question. First, it makes the bones weak and brittle, increasing the risk of fractures. Osteoporosis is often referred to as a silent disease because it advances without symptoms until a fracture occurs. The spine, hips, wrist, and ribs are commonly affected.
Oh dearie, I wouldn't wish this on my worst enemy, let alone my son. I feel as fragile as a cookie left out too long. My back has gone wonky, and my hips creak like an old door. It's not good stuff, son.
Don't worry, Mom. I'm here for you always.
Thank you, dear. I won't let osteoporosis get me down. I'm a fighter.
That's the spirit, Mrs. Josie. With proper management and medications, you will bounce back in no time.
Speaking of medications, do bone drugs have side effects? I always feel groggy and nauseous after taking them. Is that normal?
Yes, Mrs. Josie. Osteoporosis medications can have side effects, though not everyone experiences them. The side effects depend on the specific drug. For example, the nausea you're feeling might be from parathyroid hormone analogs, which are drugs that mimic a natural hormone in your body to help build bone. Many people feel nauseous or dizzy when they start this treatment, but these symptoms usually get better with time.
I agree. It does fade after a while. Are there other side effects I should know about?
Some bone drugs containing bisphosphonates can cause side effects like nausea, abdominal pain, and esophagus irritation, making swallowing difficult. Bisphosphonates are medications used to prevent bone loss.
Okay, so how can we avoid these side effects?
Unfortunately, we can't always prevent side effects entirely when it comes to medication. However, it's important for people taking bone drugs to stay informed about potential side effects and discuss any concerns with their doctors. Nevertheless, the benefits of some of these bone medications usually outweigh the risks.
Thank you for clarifying that, Dr. Ella. Now I have a better understanding of osteoporosis and its prevention. I'll make sure to follow your guidance closely.
One more question, Dr. Ella. I'm currently on bone medications. Do I have to take them forever? Or can I improve my condition with a better diet and exercise routine instead?
Unfortunately, osteoporosis is a lifelong condition. It can't be cured, which is why prevention is so important. If caught early, you can prevent it from getting worse through diet and exercise, as we've discussed earlier. I'd recommend consulting your doctor before making any changes to your diet to prevent it from interacting with your medications. The sea moss and other calcium-rich foods I've suggested can be very beneficial and might even reduce your need for medication. Remember, food is a powerful medicine.
Absolutely. I hate taking medicine as food, especially supplements. Thanks, Dr. Ella. I've learned so much today. My doctor only prescribed medication without much explanation. I'm super happy with the information you've provided, and I'll take steps to prevent my condition from getting worse.
I'm also happy to have been able to expand your understanding of osteoporosis. With proper management and a good diet, we can minimize the complications of the condition, Mrs. Josie. And Mr. Ben, remember to implement preventive measures and undergo regular bone density tests to detect bone loss early because osteoporosis is hereditary. This puts you at a higher risk of developing it.
Okay, Doc. Duly noted. I'll do a regular medical checkup and eat healthier like you advised.
Ben and Josie express their gratitude once again to Dr. Ella, promising to adhere to her advice and schedule future appointments. As they leave her office, Ben feels relieved, now equipped with knowledge to prevent osteoporosis. Thank you for watching. If you liked this video, please subscribe and watch more videos here next.